there, you are listening to IWG Radio, the place to be for all of your wellness needs. We just want to take a moment to thank you so much for listening and just let you know that any of the information that is provided is strictly for an educational resource and is not intended to diagnose or treat any conditions. The lifestyle interventions discussed should not be used as a substitute for any type of conventional medical therapy.
So I am Dr. Kyle, and I'm here with Dr. Phil.
Hello, everybody.
And today's episode, we will be chatting about the development of the cranial bones, the dura, and the infant craniosacral system, and some other implications and health concerns that can arise at this time. And hopefully you enjoy the content today. So as you may know, Dr. Phil and myself both practice craniosacral therapy, and we've been learning some really cool stuff. So what I'm going to start with is chatting a little bit about how our cranial bones actually form. And it may not be something that we usually think about, but it is actually very, very important, and a lot of say health concerns or how we grow and change and develop can be attributed to this time in our life. So during the birth process, our cranial bones are soft and moldable, and they aren't actually fused bones and joints yet. These bones actually form from the membrane that surrounds our brain. And if you kind of think about if you're on a lake or a body of water and it's really cold and you see some little islands of ice floating around the water, if the temperature drops and those pieces of ice begin to grow, eventually they begin to grow larger and closer together, and then can begin to touch and form what kind of look like joints. And beneath those big pieces of ice is still the water. So we can kind of compare that to the craniosacral system that's within our head in our infancy. So the water is our cerebrospinal fluid, and those pieces of ice are our cranial bones that are forming. And even though they appear that it's one big solid piece, they still move around. And any sort of input that can happen in the other side of the lake or in different areas in the body of water can affect the entire system. So let's think about that in real world terms, if you will. So hopefully that visual helped. So let's say, for example, you are born, a wonderful, beautiful, natural birth, and the cranial bones look great. There's a good head shape, but there's some molding that had happened as you come through the birth canal, which is completely normal. Those bones are doing that because they need to move around a little bit to make sure that baby's passage through the birth canal is a little bit easier. And one of the things that helps those cranial bones naturally mold back to their proper position and shape is the suckling motion from breastfeeding. When baby attaches to the breast and begins suckling, the intraoral pressure helps to rebalance the membranes within the brain and helps to allow those cranial bones to remold, realign in their proper position, and be where they're supposed to be. So as a little exercise right now, we'll take a minute and place your tongue at the roof of your mouth, close your mouth, and begin to suck and kind of hold that a little bit. And what I want you to notice is how the inside of your head feels. Do you feel that only in your mouth? Do you feel it in your tongue? Do you feel it maybe around your temples or at the top of your head or in the back of your head? So that pressure that's being created is also happening within the infant's head. And that's supposed to happen. That's totally normal, but it's something we may not really think about. Also, this is very important to consider as we compare something like breastfeeding to bottle feeding, where when baby sucks from a bottle, not as much pressure is needed for for baby to get milk from a bottle. Now, what I'm not saying is one is better than the other. It is not a conversation about that. It's just comparing the two to give you more information about how our body can naturally, get to its normal state, and some things that work in one way and some things that work in another way. So I found that very, very interesting and wanted to pass that information along.
I have a question, Dr. Kyle. So if for some reason, whether there's a latching issue or the mother is unable to provide milk through the whole feeding period or during that development, how can we allow that space or that proper expansion? As I was doing that exercise, I actually felt expansion in the front of my skull in the forehead area. So say if there's maybe a delay, if the baby is not able to breastfeed the whole time, how can we allow that space to, and the pressure and that expansion and growth happen, say if that wasn't going on during the whole time?
Sure. So there can be many reasons why babies latch or transfer or other issues that may arise with breastfeeding, but we'll just take this particular concept this time. There are other reasons, say tongue tie, lip tie, torticollis, which are other things that can be certainly helped through specific craniosacral therapy modalities, and torticollis also with some chiropractic work as well. But for today, we'll focus on that. So if those cranial bones are not molded properly, let's just say maybe birth was a little difficult. Maybe the baby was in the birth canal a little bit longer, and there's some extra pressure around those cranial bones, or maybe baby had to be delivered via, a vacuum extraction or a forceps or a cesarean delivery. However birth happens, that's how it happens, and we can work with that. But when those bones are not molded properly and not addressed, then there can be longer standing issues that can continue, over a period of time. There are some things that, can kind of work themselves out, but if we think about the front of our cranial bones, so that's our frontal bone, and then along the tops and sides are our parietal bones. In the back is our occipital bone, and on the sides around our ears are the temporal bones. Now there are bones within the cranium as well, but we'll just talk about these specific bones today. So for example, let's just say there's some extra pressure on the frontal region or the frontal bone, and Dr. Phil will provide some more information about what could happen if that's the case.
So the frontal lobe has a very important process for our well-being, in that it's a higher brain center. It's our executive processing, how we're able to take information in, complex issues or problems, and organizing them and distributing them through the rest of the brain. So say, for instance, that the baby did have trouble with the breastfeeding and that expansion wasn't able to happen, there could be some developmental delays in that area of the brain. And so I'm thinking in particular, if we do know our birth story, or we start doing more research and we do realize that, oh man, I was not breastfed very much and I was put on a bottle or pacifier, maybe that can contribute to my development as I went into adolescence, into early adulthood, and maybe why I'm having symptoms or cognitive delay as an adult. And so I'm just thinking about, especially with the frontal area, making sure that area is freely movable and the brain is able to develop the best of its ability as we become adults and we're being exposed to those higher brain centers or those situations in life where we have to analyze and organize. If we have delays, maybe since we were a child, that can explain why maybe we're experiencing symptoms as adults.
Absolutely. So in short, if we are able to take a little pressure off of those bones that have some tension within them or within the dura surrounding that area, we can help gently give the body some more balance and help some of those issues that may be present. So next, the parietal bones. So again, as we said, the parietal bones are the sort of sides and top part of our cranium, kind of like a helmet, if you will, and they surround and protect our parietal lobes of our brain. And if there is some extra pressure or tension here, that can present in specific ways as well.
If there are compromise to the parietal area, there may be delays or difficulty with spatial awareness, problem solving, and also possibly with sensory and taking in the environment.
So if we think about this, we're going to do another little exercise. So to show you what it might feel like to have extra pressure around the parietal bones and the parietal lobes, just kind of interlace your fingers, and then with the palms of your hands, kind of cup the top and sides of your heads and apply, it doesn't have to be a lot, just gentle, constant pressure. And then keep that pressure, and after a while, see how you feel. You might feel a little uncomfortable. You might feel a little irritable. You might not like that constant pressure. You may feel like you want to say things in a different way. You might have a little bit of a short fuse. You might not want anybody to, approach you or touch you in a certain way. This is a very similar presentation of a child that may have some sort of sensory processing issues. So when there's extra tension within these bones, on the lobes, in the soft tissue, around the cerebral spinal fluid, around the brain, that is something that can arise. Next, our temporal bones, which basically surround our ears, if you think about it that way, on the very sides of our brain. If there's extra tension in this area, that can attribute to specific things as well.
If there is tension in the temporal area, one can possibly experience reading difficulties, so dyslexia, difficulty organizing words, finding meaning in words, also balance, vestibular inner ear issues, and possibly concentration. And so that's often found with if there's tension or abnormal functioning in the temporal area.
Absolutely. And then at the very back of our head is our occiput. So our occipital lobe of our brain deals with our visual center and can also have a lot of input with balance and coordination. And if there's extra pressure there can be some specific things that we might see.
For sure. I'm thinking also the brainstem is located. So as Kyle mentioned, that's our coordination, balance, cerebellar activity. And then also it leaves more space for the upper bones in the neck, the atlas and axis, which are important areas for our cranial nerves that go into the deep brain centers and also into the face, eyes, mouth, as well as the vagus nerve, which it goes down to our gut and enteric nervous system. It's a very, very vital nerve to keep healthy and keep the space around that area, around that nerve, and the impulses, the input from that nerve down into the body, back up to the brain. Keeping that nerve happy and healthy can create a world of difference in our health.
So what we are trying to present today is a concept of understanding and acknowledging our birth story and our birth journey, and how things that may or may not have happened around this time can contribute to our physical, emotional well-being throughout the lifespan. So we'd like to take the opportunity to allow you to think about other avenues, such as craniosacral therapy, to help maybe yourself or your children experience a different modality that can be very light and gentle to help release tension in the dura, in the soft tissue surrounding the brain and the rest of the body, allowing the cranial system to be in better balance, to allow you and your family to experience the world in a calm and gentle and balanced state, and not in a constant state of stress and tension.
Very well said, Dr. Kyle. I fully agree. The therapy is it's quite beautiful in the fact that it allows us to change our state of being and really tune into a system that we often don't get checked and worked on. And I think most of us have had some sort of difficulty or trauma in our birth, or we don't know anything about it. And we are still able to help this system stay healthy throughout our life. And as we continue to do that, like Kyle said, I think we become more loving and connected human beings. And from there, I feel like society gets better. And when you have a healthy society, I feel like that's when
everybody is happier and healthier.
Beautiful.
So if you are resonating with the information that we spoke about today and are looking to take that next step, we invite you to take advantage of our complimentary 15-minute strategy calls. We're always here to have a nice little chat with you, and you can access on our website. We thank you so very much for listening, and we will see you next week.
Thank you.
Bye-bye for now.